My name is Veronica, or at least that's the name I go by professionally, and that's the name of this channel, so that's what we're going with. My son's name is Kellen. He's almost 8 months old, and today I really want to share my birth story. It's really important to me to get it out there because it was such an amazing experience, and I also really want people to hear how special it was. So first, some context. My son has dwarfism. He has the most common form, achondroplasia, which is what Peter Dinklage has. And he inherited it from his father. So average size parent and one parent with dwarfism, it's 50-50 whether their child will inherit it, and he did. So we had the benefit of foreknowledge, where when we found out that he would indeed have dwarfism, we already knew one or two things about dwarfism. So if you don't know yet that the vast majority, like 80% of people with dwarfism have two average height parents. So the vast majority of the time, it's a new mutation and they're totally surprised by it. So in most situations, they're not like ours, where we already know about dwarfism and are integrated with the community. For most people, it's a big surprise, and I'm sure that can be really frightening. So I really hope that if that's you found this video, because I can imagine if this is a whole new world for you, how uncertain it would be. So there's the context, right? And if you're not familiar with achondroplasia, hopefully you've seen Game of Thrones and you've seen Peter Dinklage. But main characteristics, physical characteristics of achondroplasia are short stature and proportionally shorter limbs and a large head circumference. And there are some health complications that can come with achondroplasia. You know, they appear in different degrees for different people. My husband, fortunately, has not been super impacted by achondroplasia-related health issues, but there's varying degrees. But it's important to note the head circumference is kind of it figures prominently in this story. So, as the title says, I was fortunate to have the unmedicated hospital birth that I had dreamed of and prepared for, and that is not usually the case for average height parents birthing babies with dwarfism, and I'll explain more about why that is. There are only 30,000 people thereabouts, little people in America, so most providers don't have any experience hands-on with treating patients of parents with dwarfism or treating patients with dwarfism. So at the end of this video, I'll put some more resources for people you can connect with, research, that at the end. So now let's jump into the story. So a little bit about pregnancy. It took us about a year to conceive Kellen. And my pregnancy was awesome. Like the first trimester was the usual fatigue and nausea, but around 12 weeks that kind of abated, and it was great. So I danced professionally and I danced throughout my whole pregnancy. I stopped dancing at my restaurants around 5 months, but kept doing like community gigs right up through month 8.5, which I think made a big impact on the enjoyment of my experience. So our preparations took the form of a 12-week Bradley method class that we took in person here, and I live in Central Florida, so we took a class here in Central Florida, and we also hired a doula, which that's my number one piece of advice, is get the doula. No matter what kind of birth you are hoping to have, get a doula. And I just researched constantly, nonstop, listened to tons of birth stories. I read everything. I read multiple books. I read all this research about pregnancy and birth generally, and also about babies with achondroplasia. But yeah, I just consumed everything I possibly could. It was like my second job. And yeah, so pregnancy was awesome. I really enjoyed being pregnant, genuinely. As for my care, I opted in the beginning for the obstetric care model. And then there was a period of time right Okay, let me pause for a second. So now we know 20 weeks is too early to determine if a baby has dwarfism, okay? But God bless them, none of my care providers have ever really handled the situation before, so they didn't know that. And the MFM that we went and saw at the 20-week anatomy scan told us, yeah, he's almost certainly average size. And then we went for a follow-up scan at 24 weeks, and that's when the characteristics trending towards dwarfism appeared, and then we learned he would actually almost certainly have dwarfism. So we did get a little taste of what it must feel like to be surprised. But yes, leading up to that, I was still, even though I was very healthy, didn't have any other complications, I was still categorized as high risk. And my experiences weren't always great, as I'm sure a lot of you have shared this experience. In the practice I go to, it's a big practice. They have like 8 or so OBs that rotate at the hospital, and they suggest that you jump around and meet with different MDs in the practice, so that maybe you'll have met them once if they wind up being the ones that deliver you at the hospital. So that gave me a lot of stress. But anyway, I jumped around to different ones and just wasn't really jiving. Like the very first one we met, she was actually a nurse practitioner, but it felt like she was trying to shock me, when answering some of my questions in a way that was kind of condescending, and I didn't enjoy that. And then another one that we saw, I was 20 weeks and he just started talking about 39-week induction just because, and said some crazy things. And so when I was surprised, and I'm learning to communicate better, but I immediately was just angry. But I was surprised that he just started talking about that, and I told him that wasn't what I wanted. He just kind of launched into this diatribe about how, well, a lot of women don't want to labor and blah, blah. And I just thought that was a crazy thing to say. And he didn't bother to ask me any questions about my goals. And so I didn't see him again after that. And I saw 3 different MFMs. So for the first part of my pregnancy, I saw one a couple of times. And then he left the practice, and we saw another one who I didn't even remember her mentioning 39-week induction, but apparently she did, and she put it in my chart. And so I didn't find that out until later. And that was dismaying as well, because anyway. And I met another one that, lectured me, it was a regular MD in my practice that lectured me about, well, we're treating 2 patients, and just very condescending. So I really did not enjoy most of my experiences with the obstetricians that I had thus far encountered in my practice. And just the thought that I wouldn't know who my provider was going to be on the day of was really causing me a lot of distress. So while on one hand I really loved being pregnant, it kind of felt like my doctors were trying to suck the joy out of this experience. However, then one day I went to see one I hadn't met yet. His name, I guess I shouldn't mention his name. We'll call him Dr. P. But I went and saw Dr. P, and he was amazing. He was like sort of awkward at first, but I think that's part of what endeared me to him, is he was just so much more genuine. It felt like than the others. Not that any of them ever had a problem speaking their mind, but it was so much less judgment, no condescension. And that was the appointment to which I brought my birth wishes document. And nothing on there was shocking to him. Like, he let me know what I might get pushback on at the hospital, but he was totally cool with everything that was on there. And he was the best, and now I'm madly in love with him. He's the greatest. So after I met him a couple of times, eventually I just, long story short, asked him if he would be the one to tend my son's birth, and he said yes. So there was always the chance that he wouldn't be able to make it, like he might be in clinic, but he would do his best. And spoiler, he did come to my son's birth. He came in on a Sunday on his day off, and it was just the coolest and best thing. And it really made a huge difference in how comfortable I felt, and yeah, it was awesome. So luckily, while a lot of the pregnancy was rather fraught in terms of care, towards the end, like after the 30-week mark, it got a lot better. And I wasn't able to see Dr. P for my 36-week appointment. So 36 weeks is typically when they do the GBS swab. And so I saw someone else, and I really did not want someone to swab my beehole for me. So I just asked to do it myself. And she was so kind of surprised, but I was able to do it, and I just did it myself in the clinic, and that was fine. So if that's something that bugs you, just ask to do it yourself. Let's move on to the labor part. Yay! So the week, like 30, almost 39 weeks came along. So like the day before I hit 39 weeks on a Thursday morning, I had thought a lot about it, and I asked for a membrane sweep. He never pushed it on me, but I asked for one. And I asked him not to tell me my dilation, but I like literally couldn't help myself. And in my chart, I went and looked to see what my dilation was in my chart afterward anyway. And it wasn't a lot. It was like 2 centimeters and -2 station, but he was able to do the membrane sweep. And that evening we went out for like a nice dinner as kind of like a last date before baby. And I had some on and off, they felt stronger than the Braxton Hicks, which I'd had a lot of throughout my pregnancy. I had, from like 20 weeks on, I had Braxton Hicks constantly, even though I drank a ton of water. And yeah, so they were stronger than usual, but now I look back and that was not labor. So Friday night, they started coming a lot more strongly, enough that they kept me up and like woke me up in the wee hours of Saturday morning. So like the wee hours Saturday morning, we thought maybe this was going to happen. And I was like, we were getting ready to maybe go to the hospital, but then they just like petered out, and which was disappointing, but especially disappointing because I was so tired. But we were able to make it to our CPR class later that morning, so that's good. And throughout the whole CPR class, like I would just be getting random ones really tight, and then I started to get some bloody show, like not a lot, just like little bits of bloody show here and there. And yeah, but they just like kind of died out for the rest of most of the day until around 4 p.m. My husband and I were intimate. And then like an hour after that, 1 or 2 hours after that, I remember it was around 6 o'clock, so we went to the movies. The movies, I haven't been to the movies in so long. But I remember in the movie, the contractions were coming really regularly. So every time I would get one, I would squeeze my husband's hand, and it was like consistent. And at that point, I was pretty sure it was happening. So that's the point I would say early labor started, because they just started and never stopped. We got home, I tried to slept like a little bit, kind of on and off, but they were starting to get intense enough that I couldn't really sleep through it, and I was still able to talk through it. And now I know that how high the scale goes, I would be like, yeah, that was nothing. But at the time, it felt like something. And I started to get like a little wigged out on Sunday morning, and like early, still dark out, I was starting to get wigged out, where it was stressing me out a little bit, and I was trying to use the timer, but it's just like hard to time when you're focused on other things. And I just got a little psyched out because I felt like, oh, I can't feel the baby moving during the contractions, and they're frequent enough that there's just not a lot of opportunities for me to feel him moving. He was fine, but my doula was trying to like talk me down off the ledge, but eventually I talked my husband into taking me to the hospital, and the car ride there was terrible. It was a lot, because it was a little intense at that point. But anyway, I get to the hospital. I texted my doctor, and I feel so bad for dragging him to the hospital at 5 a.m, but he got there. So the gal who checked me, I was again only at 2. And they tried to reassure me that I did the right thing, because they monitored my contractions and triage for a while, and they were coming every 4 minutes, consistently for like more than an hour. So they tried to reassure me I wasn't being a silly goose, but of course baby was fine. Everything was totally fine. So it was recommended I go home. So we did. We went home and just like labored the rest of the day. We walked around. I failed to mention that the previous night we'd done some curb walking, and all the neighbors saw us and had a comment about it. Yeah, so we just did some walking around, and yeah, it was, like, yeah, I guess I would describe it as painful, but, not crazy at that point. But I can identify when active labor started, and that was right around like 3:30 p.m. There was just a switch, It was crazy. And I got on the toilet backwards, so they call it the dilation station for a reason. And I was sitting on it backwards and like gripping the toilet lid. And I remember like there were times where I was ugly crying. At this point, I was using my horse lips because up to that point, our doula was like, well, she's still talking through them. She's being very nice about it, but if you're still talking through them, it's not time yet. And but now I was like through all the contractions, ugly cried a few times. It was getting crazy. I started to get really nauseous, and so my husband got me like a little bag to throw up, and I was just gripping the bag, and I didn't throw up at that time, but I felt like I was going to. And so the doula called to like listen to me for a minute, and she had been saying, okay, I'll come over to your house. And then once she listened to me for a minute, she was like, okay, I'll just meet you guys at the hospital. So I purchased a labor gown off of eBay. That was a lot more comfortable than the paper ones. And so I put on my slippers and my labor gown, and I got like a little stuffed animal. And we loaded up, and he's shoved me in the back seat, and I was not buckled in. There's no way I could just sit down. So I was like this in the back seat the whole way there. Luckily, it was only like 25-minute drive, but every time we came up to, there's so many speed bumps out of our complex, and every time we came up to a speed bump, I was like, stop! And we had to wait for the contraction to end before he went over the speed bump. And yeah, that was a car ride from hell. But luckily, it didn't slow my labor at all, which I hear can sometimes happen. The car ride will like shut it down, but that's not what happened. And we got there, and luckily our doula, she got there at the same time, and she got a wheelchair, and I sat on the wheelchair like this, and was just hunched over, and she wheeled me over to triage, and they were like asking me questions and shit. And luckily the company through which I hired our doula had this nurse's cheat sheet that I'd filled out, and so I was able to hand that to them. But then they asked me like to type in my social, and I was like, numbers. So it took me a minute to like dig out that file from in here. And they put me in a triage, and we were in there for like less than an hour. And so Dr. P was already there, and he came down to see us. And I remember one of the other nurses being like shocked, and then remarking when he left the room, like, oh, they never come down here. But he's a very thoughtful person. So he came down here to say hi. We had brought some lemon bars that we baked, and so we gave some to him, gave some to the nurses in triage. Highly recommend bribing the hospital staff with treats. It works. And at that point, the contractions were like every 2 minutes, and they were intense. And I was so shocked when the nurse checked my dilation, and I was only at a 3, but she was like, okay, I think I could stretch you to a 4. Did her little thing. And but I don't think there was really any question about admitting me, especially since Dr. P was there, and he was kind of the one to make the call. Because oftentimes they don't want to admit you if you're like under 5, but I think it was very obvious something was happening. So we got to the hospital around 5 p.m. and we got up to a room like within an hour. So I opted for just a hep lock. So I had an IV put into my hand, but not attached to any fluids. And then we got up to the room pretty quickly, and I had wanted intermittent monitoring. So originally I wanted just like with the handheld Doppler, but Dr. P said he would, it would be more comfortable for him if I did on the regular monitor, just, for 20 minutes at a time every hour. And I was like, okay, that's fine with me. So I got on the bed, and I had the ball on the bed, and I was kneeling on the bed and had my chest on the ball, and I was rocking back and forth like this while the monitors were on for those first 20 minutes. And in that time, I had my husband and our doula fill up the bathtubs. They just have like regular size bathtubs, and their policy is no birthing in it. But that wasn't really something I'd wanted at the time anyway. And yeah, so as soon as the monitors were off and the bathtub was filled, I was like, boop, into the tub. And I was good in there. I was hanging on in there for a while, and I sort of remember my husband and my doula like rubbing my shoulders and, you know, encouraging me and giving me water, and I was just horse lipping it all the way through. And I also had a comb. So I had a comb and then these little spiky balls that my doula brought that I was squeezing. And hilariously, we brought a gigantic suitcase full of comfort measures. We had everything. We had a rebozo, we had a heating pad, we had blah blah, like we had a freaking little scenty vapor things that you put in the shower and they make smell. Anyway, I'm totally blanking on the word for that, but we had everything, and we didn't crack that suitcase open once. It was just comb and horse lips. That was it. And I threw up a couple times, like big throw ups. But yeah, I just spent like most of my labor in the tub, and unfortunately it didn't come up all the way over my belly because it was just a regular tub, so it was a little shallow. But my water broke in the tub. It was kind of almost not super noticeable, but I felt like a little pop and then like a little like rush, and I could see a little bit of like color in the water, but it wasn't. It was mostly clear. It was just like a little bit of blood, so no meconium or anything. And the nurse was pretty hands off. She was very nice, and I remember trying really hard during my labor prep, or during pregnancy, my prenatal preparations, to internalize that when you are saying like, I can't do this anymore, I'm changing my mind, I'm gonna die, like that's transition and you're about to meet your baby. But when it happened to me, I just forgot all of that. And now I know it was transition, but it happened so fast. I couldn't believe it was transition, because we got to the hospital at 5 p.m. and then my son was born at 4 hours later. So for a first timer, that was crazy. It was very intense. So what I now know is transition it was just another level. And, you know, I don't want to use words like pain, but it did hurt. And not all pain is suffering. So I wasn't suffering, but it was pain to like, I could never have conceived of it before. And I'm sort of forgetting it now. I mostly just remember what I was thinking at the time, but it's hard to remember what it actually felt like. But I do recall like when the contraction would be peaking, like I knew I had to relax my pelvic floor, but when I relaxed it, it just felt so much more intense, but I knew I had to. And I was having crazy thoughts like, I should just beg him for a C-section in the bathtub right now. And I escalated from, horse lips wasn't doing it anymore, so I escalated from horse lips to vocalizing like, oh, loud moaning. And I do remember telling my doula and my husband, like, I'm changing my mind, you guys. I was like crying again. Oh, you guys don't understand. I'm changing my mind. And they're like, no, you're doing it. You're almost there. And that went on. I'm not sure how long that went on for. Not super long, but it was so intense. Oh my God. And it was so, I knew in a superficial way that feeling is just your baby moving down, but it's so hard not to like want to pull away from it. So I just endeavored to relax and breathe, and it was hard. And then at a certain point, I felt like I had to poop, but I still didn't register that meant my baby was about to be born. But I was like, I have to poop. And like right around the time I said that is when a couple of nurses came in the bathroom and they were like, honey, it's time for your monitoring. So I guess that whole time was like, it was an hour. And they're like, and this part is really foggy. I told them I felt like I had to poop. And then I don't know how many hands were on me, but they kind of like got me out of the tub and somebody was toweling me off. And then they like tried to lower me onto the toilet. And as soon as my butt was within like 3 inches of the toilet, I was like, and so I thought I was trying to poop, but it was totally involuntary. And I didn't hear this at the time. I didn't pick up on it, but my husband said that he heard the nurse stick her head out of the bathroom and say, call the doctor, she's pushing. And so I think I like heaved a couple times on the toilet, and then they somehow got me from the bathroom to the bed. I have no recollection of that happening, but I know that it did. 'Cause wow, it was a lot. It was a lot. So when I first got on the bed, I was sort of on my back, a little bit on my side. And he checked me, and I was at 8 centimeters. Yes. And in my mind, as we were going from bathtub to bed, I was like, if he says 5 centimeters, I'm changing my fucking mind and I'm getting an epidural. So I was very happy that he said 8 centimeters, yay. And so I at that point I was pretty much pushing involuntarily. But I labored for a little bit on my sort of side back, and I remember my back was accessible enough that my doula was able to like get in there and do some hip squeezes during the contractions. But I was straight screaming at that point. She took a video of me at that time, and I was just Tarzan screaming and holding my crotch. And I felt like in that position, I would say it was more painful. I mean, it's all extraordinarily intensely painful, but it felt like I couldn't harness my power in that position. So then I said, hands and knees, and somebody put the head of the bed up, and then they helped me flip over to my hands and knees, and I just like gripped the bar at the top of the bed, and that felt a lot better, where I could just like harness my power. And I know the contractions must have spaced out, because I remember my doula like leaning in and telling me like in between, like, if they're giving you a break, this is your chance to catch your breath. And she was kind of like breathing next to my ear to kind of like help ground me. And so I was like Tarzan screaming on all the contractions, and then I think kind of just moaning in between. And I remember Dr. P checking me again at some point, and then saying I had a little bit of an anterior lip, but I can try to push past it if I want, which in my mind, I was like, that's funny. If I want, there's no if I want, like it's happening. Like I couldn't control it. It was like throwing up out of my butt. Like it was totally involuntary what was happening. So at that point I was pushing, like from when I got to the bed, there's some time signatures on the text. My husband texted my mom that I was 8 centimeters. And then 30 minutes later, he texted her that my son was born. So we went from 8 to born in half an hour. So at that point I was pushing, and I think I tried to like keep pushing in between contractions, because I do remember Dr. P saying they push more effectively if you wait for the contractions. And I was like, okay. So I like tried to catch my breath in between, and man, I wish I had done this sooner, because it gets so foggy, like your hormones make you forget. But yeah, it was crazy. And so I could kind of feel that he was starting to crown, but apparently he went, did the thing where he kind of like turtled a little bit a couple times, just normal. And when he was getting close, I registered that the nurse said something about going to get the NICU team. So I forgot to mention earlier in the story that he was categorized as IUGR, intrauterine growth restricted. And that is because the formula that is used to guess the size and weight of a baby in ultrasound is all jacked up when their proportions are different. So he has dwarfism, his proportions are totally different. So they're taking abdominal measurements, the femur length, head circumference, like biparietal head diameter, like, so those are the things that they're using to guess the weight of the baby. And so because his proportions are like totally different than an average stature baby, he showed up like that. It made it seem like he was going to be 4.5 pounds, which was not true when we knew. And Dr. P also acknowledged that this is not accurate, because this is just a different situation. And so I remember, if he had been another provider that didn't really know anything about us, like this probably could have gone totally differently. But I remember he caught up and explained to the nurse about achondroplasia and that we didn't need the NICU team. So luckily there was no NICU team in the room. Like that might have totally changed the vibe. So I'm really glad that he jumped on that. And yeah, so my husband was down there, watching and wiping my butt, because he's my knight in shining armor. And I remember, well, I knew I was pooping. A lot of people say they didn't realize they were pooping, but I knew it was happening. Whatever. I have bigger fish to fry. And I threw up another time while I was pushing. I remember on hands and knees, I threw up there too. But then as he was like really coming out, I knew I was tearing, but I did not care because the contractions were so much more intense than the sensation of tearing, by like a lot. So I just didn't care. And I had thought ahead of time that I was going to be this like Zen birthing goddess, and that I was going to be breathing my baby out and I was going to finesse him out. And that's not what happened. I was just like all power, just all, there was no finessing anything. And so even though I knew I was tearing, I was like, just pushing as hard as I could. And I could sort of feel my doctor kind of like grab Kellen and help guide him out at a certain point. And I was glad for that, because I was really ready for him to be out of my body. And yeah, and he, like, once his head was out, the rest was like just basically fell out. And that's the part where I'm like, it was just so, it's so shocking. It's so shocking. Your baby coming out of your body. It's crazy. And so he was born on hands and knees, which was really cool. And my doctor, with the help of the nurse, like kind of handed him to me between my legs. And I remember I was sitting there on my knees and holding him and just saying like, my son. And I just couldn't believe it. It was so cool. And I sort of remember like the nurse like rubbing his back, and he did cry. I don't know if maybe he didn't cry right away. Like, honestly, I was just so overwhelmed with like the sensations and also the fact that I was holding my son. I just didn't even register so much of what was happening. And oh, he was just so cute. And he was not growth restricted. He was 7 pounds, 1 ounce, and which is bigger than either me or my husband when we were born, and we were both term. So, yeah, I forgot to mention he was born at 39 and 2. And then they helped me flip over. So like the nurse held him while they helped me flip over onto my back so I could hold him on my chest. And, so yeah, I held him on my chest. I remember trying to pull him up, and they're just like, don't pull him up too much, you're still attached. And I was like holding him and just like like kind of moaning, and I was looking at his head and being really amazed that he had reddish blonde hair. My husband's half Korean. You see me. I had dreams that he was going to come out with like thick black hair and dark eyes, and I was completely wrong. He had blue eyes and still does. His eyes are still blue, and like blonde hair. And I couldn't believe it. I was shocked. But yeah, I had informed Dr. P that I would like delayed cord clamping, and I didn't have to remind anybody of anything. Like all of that stuff was honored, which is so great. And I just, at a certain point, I was so wrapped up in my baby that he was just like, got my attention. He was like, oh, can I clamp the cord now? It's been several minutes. It's basically done. And it was like just totally white, not pulsing anymore. And so then he clamped the cord, and originally my husband had not planned to cut the cord. And so I was like, to my doula, you want to do it? And she was about to, and my husband just stepped in. He was like, actually, no, I got to do it. So he did cut the cord, which is cool. And so yeah, cut the cord. And then I'm pretty sure placenta came after the cord was cut, but I don't remember. I just do remember at one point just hearing Dr. P pipe up like, hey, can you give me a little push? And I just went like, and then felt like a jellyfish coming out of my vagina. It actually felt kind of nice. And so placenta was good. It was all good. He showed it to me. I was like, show it to me. He's like, oh, hold on a second. He has to examine it. And so the bag was still like mostly intact. And he showed it to me, and it was really cool. It was very cool. It's a nice, good looking placenta. And then I had a 2nd degree tear, and he stitched me up, and they did shoot my taint up with lidocaine, but it was still very unpleasant. And I do remember saying, I was like, I wish I had the epidural for this part, because at least the pain of giving birth was like life-giving and powerful. But the stitching was just drudgery. It was terrible. But oh, what can you do? He did a great job. And so yeah, he stitched me up, and I don't really remember when he left. Like, I know he said goodbye, but all that is kind of a blur. So then the nurses like wiped me up, and I'd bled some, but not to an alarming degree. And nurses cleaned me up. Eventually Gina, or my doula, left. And when it was time for me to go pee, because they really want you to go pee after you have a baby, a nurse walked me to the bathroom and I passed out on the toilet. And she, only for like less than 30 seconds, but yeah, I had become really dehydrated from throwing up. And so she got me back to the bed, and at that point I was glad I had the hip lock, because then they could just hook me up to some fluids. So they let Dr. P know, and he said to just give me like a bag of fluids. So I just hung out and got my fluids while my husband had skin to skin with our son, which was really sweet and cute. And we texted my mom, and then she came around midnight or maybe a little after midnight, and she was the first time I got to meet him. And he was really cute. Like, his head was so nice and round, and he's just the cutest and best and so perfect. I couldn't believe it. He was so gorgeous. And he's just gotten even more gorgeous. It's nuts. But yeah, after my fluids, I can't remember how long we were in the room before we went to postpartum, but we eventually, they wheeled us up there, and my mom helped, and she kind of got us set up, and went and got us some food. It was the cafeteria. They didn't have, like, the good food wasn't being served. It was just the, like, after hours. So we got a couple of crappy hamburgers and Coca-Colas, but man, they were the best hamburgers and Coca-Colas we ever had. And yeah, so that then she left, and the postpartum bit, I would like that to be different next time, because this birth was so amazing, but postpartum felt like Guantanamo Bay, because them coming in to check your bleeding every hour and a half was just literal torture. Like, they use sleep deprivation as torture for a reason. So I would like that part to be different next time. But our son was just so cute and awesome, and I had some lactation help. He had some trouble. He just wasn't, like, his latch seemed to be okay, but his suck wasn't very strong. Probably not related to dwarfism, because he really doesn't. The degree to which he's affected by it is still pretty minimal right now. Like, you wouldn't know he was a dwarf unless you were really unless you knew what you were looking at and you were looking for it at the time. Because some babies with dwarfism have, like, a very small midface, and sometimes that can interfere with their ability to nurse effectively. That wasn't really the case for him, but yeah, so he wasn't breastfeeding that well. And postpartum, that whole journey was like, we wound up doing bottle, and then breastfeeding for a little bit, and then kind of back to bottle. And I had thought I was going to exclusively breastfeed, and that's just not the shape that my journey took. But those first couple of days, there was a certain point where I felt like I just needed to send him to a nursery, but I was so torn up about it, because I was like, oh, they're going to give him a bottle, and if he has a bottle, then breastfeeding is over. And now, knowing what I know now, I would have sent him to the nursery way sooner. And I was so nervous about giving him a binky, but because that would ruin breastfeeding, and none of that's true. It just took me some time to be open to changing our plan, and it all worked out wonderfully in the end. So breastfeeding wasn't a huge part of our journey, which is really different than I'd imagined, but it was okay. I did get to do it for a little while, which was really nice, and maybe in the next baby it'll work out differently. So we were in the hospital, I think, for 2 days. He was born Sunday night, and we went home Tuesday afternoon. So almost 2 days, but it felt like a lot longer. And we had some family come and visit, just our parents, my parents, because they live local, and my siblings, and then my husband's mom came down from Virginia Beach like a week later, I think. We took them home. The cats were like, what the fuck is this? They were not interested, still are not interested. And yeah, this story is getting a little long, so I won't get too into the postpartum, but it was like 100 times worse than I thought. Like, he was so great, and he was so healthy and wonderful, just so fucking cute. Oh, it was so cool to have my sweet little baby, and I loved when he would sleep on us. But at the time, I followed the recommendation of waking him up every 2 hours to feed, and that. I don't think I'll do that again unless my next baby, hopefully, we're lucky enough to have another, unless they are stalling on their weight gain, I'm not going to wake them up every 2 hours next time. And also, we were taking turns. One person would sleep in the bedroom with earplugs and white noise for 5 hours, while the other would be in the living room with the baby, trying to catch sleep when you can. But we have this creaky ass couch, and I don't know why we were shocked that he would wake up more often than every 2 hours, when we were like, we'd put him down and then get on this loud ass couch, and of course he would wake up. So the things you learn along the way. So yeah, the sleep deprivation was really rough, and also like with the medication I take, it was going haywire with pregnancy hormones. So my physical recovery was really excellent. You know, my stitches weren't too bad. Like it was, my bleeding didn't last super long. Like physical recovery was totally rad. It's just emotionally, it was very hard those first few weeks and felt very lonely and isolating, which I know is pretty normal because your world just like shrinks. So although I enjoyed my baby a lot, that was a lot more challenging than I thought. But I started to turn a corner around 3 weeks, and then around 2.5, 3 months is when I felt like normal again. And now he usually sleeps through the night more often than not. That started around like 6 months, which if you told me that back when he was first born, like, oh, around 6 months he'll sleep through the night, that would have felt like an eternity. But now it's like, oh, did postpartum even happen? Like, it's just like a weird dream. I can't believe that happened, but I survived it. And now he's so awesome. So like it started to get really fun around 2.5 months when he was able to interact more, and I was feeling a lot better. And I, most importantly, I started dancing again. I think I did my first gig 6 weeks postpartum, which I'm really glad I did, but it was Bollywood and there was a lot of squatting and jumping, and therefore a lot of peeing was happening. So I didn't do my next one until like 2.5 months. And then around 3 months, I was like back full-time dancing. And that hugely helped me just to be moving my body and just getting that artistic expression and being out and about among people. Like that made such a vast difference in my mental health as well as my physical recovery. And yes, so now it's fucking awesome. I love being his mom. He's just so cool and he's so personable. He's such a great personality. He loves meeting new people. I did have like a little bit of incontinence for a while, but that kind of fixed itself for the most part. So now it's like if I do a back bend really quickly, then a little bit might come out, but overall it's great. And I did have some painful intercourse like 6 months postpartum that I went and saw Dr. P for. But that has gone way better, and that's pretty much gone now. I did like a little bit of physical therapy, and then it just sort of like turning 30, something strange and magical happened, and now that part of my life is really excellent. So yeah, my physical recovery feels mostly complete to me, and we're just having a great time, and I'm baby crazy. I can't wait for my next one. And I hope if it can be helped, I would love to have a home birth or a birth center for the next baby, even if they have dwarfism, because we looked into having a home birth when we thought he was going to be average size, but when we found out that he was going to be a dwarf after all, then we decided to just stick with hospital. But now that I've had one come out of my pelvis, I would like to have a home birth or birth center for the next one, mostly because the postpartum bit was just such shit in the hospital that I really don't need to repeat that. But I'll miss Dr. P because I'm obsessed with him, and he's the best. Yeah, another note about how he like kind of went out of his way for me is he decided to schedule me for a postpartum visit 1 week postpartum because he heard from the staff that I was kind of having a bit of a hard time at the hospital, so he called me in to just check on me and help me out in some other ways. So he's the best. He's a very thoughtful person. And yeah, so we had a lot of help from my family. Like my mom would come and stay overnight a couple times, and my husband's mom came down and she would stay up with the baby overnight, and doula was so great, and my siblings brought food, and we were very fortunate to have a great support system. But I do wish I had prepared more for postpartum. However, you don't know what you don't know till you know it. And that's my birth story. Yay. Oh, and also I became a doula. So I was able to go to a local training program, the same company that I hired my doula from. And now I've gotten to go to two, one home birth and one birth center birth. And they're both so beautiful and awesome. And I just really didn't want to leave the birth world after my son was born because it's so addicting. It's very habit forming. And I am so excited to be a part of that world going forward. Now for the resources part. So if you are a parent of a child with dwarfism, there's an organization called Little People of America, the LPA, that's exactly what it sounds like. They have conferences, both regional conferences throughout the year and a big national conference, which literally just happened. Actually it's happening right now, but we left early. So we just got back from the national conference in New Orleans yesterday. And that was really great. So we went to the regional one in our town in October while I was pregnant. And then this one was great. So they have a community, a lot of medical resources. Like one of the most helpful parts of the LPA big meeting is that you can have one-on-one medical meetings with providers that specialize in skeletal dysplasia in different areas of care, like ENT, there's even obstetrics, neuro and ortho, etc. And genetics counseling is a big part of it too. And there's medical advisory board panels, so about different topics where you can go and ask questions in a group setting, among many other things that are like a lot more fun than that. So recommend look into the LPA if you are having a child with dwarfism. And if you are an average stature woman that is having a baby with dwarfism, you probably, I'm guessing your providers may not have had experience with this. So I implore you to seek out the expertise of providers who do have experience with this. So like Nemours and Johns Hopkins have teams that specialize in skeletal dysplasia, and some, like for example, like the Nemours people in Delaware that we were meeting with at LPA, some of their providers are also licensed in Florida, so they can do telehealth with us, and they're happy to write some like recommendations to our providers with some more information about skeletal dysplasia from their standpoint of expertise in the subject. So it's human to want to control what we don't understand, and it's my understanding from the resources I was looking at online and the birth stories I heard online while I was pregnant for women in the same or similar situation. A lot of it is colored by fear, and it doesn't have to be. So if a C-section is not what feels like the empowered choice to you, and it may, but if it doesn't, and you're like me and you really crave an unmedicated birth, natural birth, that is still possible for you. And everybody's different, but if your one obstetrician is telling you, oh, well, you can't for whatever reason, find someone else. Find other resources and connect with these doctors through the LPA. So that I can't stress enough what a fantastic resource LPA is. And I received some information from one Dr. Hoover Fong, who was really great. This past weekend, she and her cohort did a study regarding the impact of vaginal birth in an average stature woman. So if you have skeletal dysplasia or like scurvy or anything that's going to affect your pelvis, C-section is the only way to go if you really do have a small pelvis. But if you're average stature, then a vaginal birth is still possible for you. Average stature and don't have any kind of like, if you have had scurvy and your skeleton is been compromised because of something like that, then that may be different. But probably, hopefully, most of you don't. Anyway, so she gave me an example of a patient. She's a genetic counselor, and she gave me an example of a patient she had that said her obstetrician had told her she had to have a C-section because she would be harming the baby because it would be like compressing his cervical spine or something crazy like that. Like it would damage his spine to be born vaginally, and that just wasn't true. They conducted a study on it using a Delphi process thoroughly, and I will link that below. She gave me the article. So that's something, if somebody's telling you you're going to make your baby's neck problems worse by birthing them vaginally if they have achondroplasia, that's a resource you can share with them. Also, the main concern with having a baby with achondroplasia is because they have a larger head circumference. The concern is cephalopelvic disproportion, so that their head may be too large to fit through the birth canal. But that I think is very but everybody's story is different. And yeah, so one thing I just wouldn't, I think is not recommended is instrumental delivery. So if it comes to the point where like forceps or vacuum are necessary, then I think it's better for you and baby to go the surgical route. But I'm not an obstetrician. However, just my biggest piece of advice is like seek the expertise of people who know about this. Get lots of opinions. Don't take the first opinion you get if it doesn't jibe with you. because you can have a safe birth that's also a positive experience for you. You just have to make the choice that feels empowered and informed. And I just really want to stress, because not that there were many, but every birth story I found of an average height woman having a little LP baby was not very pleasant, and it doesn't have to be that way. It can be the wonderful experience that you hoped for. And people with dwarfism have very full and rich lives. They really do. I know, I've been married to one for a while now. Here comes the editorial part. I discovered throughout pregnancy that it is not uncommon for termination to be offered for dwarfism. Not necessarily here in Florida, because it's functionally illegal, but I find that devastating is a bit of an understatement. It hurts me so much to think that someone could look at my husband and my adorable son and think that their life is not worth living. So while I do believe people need to be able to control their reproduction, if you are having a baby with dwarfism or any disability, and I can understand why that's scary if you don't know anybody that has those disabilities. So you don't know what you don't know. But know that people with disabilities have full, wonderful lives. They're totally worth living, and that they make other people better just by knowing them, and they will make you better by raising them, and really broaden your mind a lot. And being with my husband has blown my mind and just made me a much more I hope emotionally intelligent person. I don't know, maybe not, but it's been good for me to have greater perspective. So if you're scared, don't be scared. Don't be scared. Your baby's gonna have an amazing life. You're gonna have an amazing life. You will never, ever, ever regret having a baby with dwarfism or Down syndrome, or really any other disability that's not life-limiting. So just know, there's so much to gain. Anyway, that's my editorial part. Take it or leave it, but my birth experience was amazing. My son is so cute, and we've agreed not to share his face on the internet, so you just have to take my word for it that he's like super gorgeous. But I'll just say he was the superstar of LPA this past weekend, and he's just, oh, I fucking love him. I love him so much. He's so cute and so amazing, and I wish I could show him off to you, but internet's a weird place. So anyway, thanks for listening. This was kind of long, but my experience was totally awesome, and I really wanted to share that with